Hello, this is Bert. Welcome to our Monday night show here at Alternative Healthcare Career. This is the Home Health Contract Show, guys. Thanks for joining me tonight. And again, welcome. If you are here with us live tonight, comment live on the comment section here at their Facebook page, Alternative Healthcare Career channel. And as we do it every Monday night, we are going to talk about home health contract. Okay. And what we do here in this show, if you're not familiar with home health contract show, every Monday, 8:30, and tonight it's 8:45, we share with you how this business model works. Okay. How does home health contract work? If you're a PT, PTA, if you're an OT, CODA, or SLP, and you want to do this as a side hustle, this is the show for you guys. Again, my name is Bert, physical therapist. I've been a PT since 1998. For those of you who don't know me, I used to be an employee from 98 to 2003. Been there, done that. Did a daily grind, worked 40 to 60 hours a week. And then in mid 2003, I started my own business, which is the home health contract business. So I've been doing this for the past 17 years. And for the past few years, I've been coaching our colleagues, PT, PTA, and OT, OTA, and SLPs. All right. And if you're not joining us tonight live, you can watch the replay. We will post the replay here at Alternative Healthcare Career channel. And you're more than welcome to reach out to me, ask me any questions about home health contract. All right. Guys, this is one of the best, if not the best, side hustle you can do as a therapist because there's no overhead. There's no requirement on billing Medicare, which is usually the bad part in most businesses, right? Going back and forth with Medicare. This model doesn't need any direct referral from doctors, and you don't need any billing codes. All right? This is what you're going to learn here at Home Health Contract Show. Okay, so if you're live tonight, if you're joining us live tonight, would you please comment and say live or hello or whatever. And if you have any questions, please feel free to ask any questions tonight. All right. I want to thank Mike and Emma and Stacy for putting this show tonight. These guys are the best. They're the ones making these things happen. And they have more than one show besides the Home Health Contract Show. And we're here to help you guys and show you what's possible as a physical therapist, as a PTA, as an OT, as an SLP. All right. What's possible for you besides the 9 to 5 job? Okay. Again, we are live. All right. Okay. So we're going to go ahead and start with the show. First and foremost, if you guys want to learn or want to look at the videos on how this thing works, I'm going to show real quick where can you grab those videos. I'm going to share my screen real quick. Where is that? Share my screen. Boom. Share screen right there. And boom. Can you guys see my screen? If you can see my screen, this is where you grab the videos. Okay? This is where you can put in your name and email and then download the videos, and then there you have it. I'm also going to put the link real quick. Hi, Christina from Connecticut. Thank you for joining us tonight. If you have any questions, Christina, please feel free to post your question. All right. So, all right. I'm going to grab the link for the free videos, guys. Where is that link? Here it is. Copy the link. And then on the comment section, I'm going to put... Mike, if you're in the background, if you can put the link in the comment section for our listeners to grab the free videos. All right. That would be great. Okay. So we're going to start off with how does home health contract business work? If you guys are not familiar with it, it's very simple. Okay. Basically, you get a contract with, it's called a B2B. So you have your own company, you have your own crew of PT, PTA, you have your OT, OTA, you have your SLP. And most of these therapists are working for you on a PRN basis. Why PRN? Because it's pay as you go. I used to have full-time employees when I was starting this back in 03, 04, 05. The problem with that is every 2 weeks I was stressed in making sure I pay my full-time staff. So after a few years, I switched everyone to PRN. That way, I only pay them when they see patients for me. All right. So it's a pay as you go. This is why you can do this as a side hustle, even if you're doing your full-time job in a hospital or nursing home, even if you're working full-time in an outpatient. You can do this as a side hustle, guys. You don't have to quit your job. You can do this slowly, start it slowly. As a matter of fact, that's how I mentor the colleagues that are in my program. I tell them to start slowly. I will teach you how to do it slowly, step by step, and do not quit your full-time job because you got bills to pay, you got student loans to pay. When you get to a point where the money coming in is equal to your salary, it's equal to what you want to make every month, then that's when you decide if you want to quit and focus on this full time. All right, that is a good position to be in. All right, but for the meantime, do not go all in by quitting and then doing this from the start. No, I don't recommend that. One of my students, his name is Trevor Larson, did exactly what I just told you. He used to work for an outpatient, and then he started in September of last year, started this on the side, and in March, I think March or February, he got laid off. But when he got laid off, guess what? He was fine. His boss didn't know that he already has his business and he's got money coming in. And so he was fine getting laid off. He applied for unemployment. So there's two sources of income, guys: unemployment money, and there's also money coming from the business. And then a few months down the road, his boss called him back and asked, "Hey, Trevor, you want your job back? You want to come back?" Guess what his answer was? No, he didn't want his job back because he was making enough money to sustain himself and focus on his business. I think right now he has 9 in his staff and life is good. Everything is great. I think he's growing. His last time I checked with him, the number of visits they do, I think, was anywhere from between 120 to 150 visits a month. That's a lot. That's great. All right. So just real quick, I'm going to show you the math. Okay. I'm going to share with you my screen. Mike, can you see my screen? If you can see my screen, please let me know, because I don't know if they can see my calculator. I'm going to pull up my calculator here real quick. All right. Can you guys see my calculator? Yes. If you can see my calculator, Mike or Stacy, just let me know on the chat. If not, let me know if I have to minimize my screen. Okay, let me minimize my screen. Okay, if you guys see my calculator, this is how we make money. It's very simple, okay? So the minimum we charge is $75 for every visit. I pay the PTA 45 or the quota 45. I make 30, okay? If Trevor was making, let's say, 120, 150 visits a month, all right, and let's say 100 of that is PTA or quota visits. So multiply this $30 profit by 100 visits. That is about $3,000 profit. Okay. That's not including what he pays himself whenever he does the eval, re-eval, and discharges. Okay. Cool. So that's how we make money. That's it. It's not rocket science. Okay. You make the margins, you make the profit on the PTAs and quota visits, and they're happy because you're giving them jobs, especially if they're getting laid off, especially if they got furloughed. Okay. Now, if the question is, how much do we pay the PTs and OT supervisors? The answer to that is I pay them almost the same. If not, maybe a little bit less. I may make $5 or $10, but that's okay because I make money on the PTA and the quota. Okay. Now, question: what about the speech, the SLP? Are we making money on speech? More often than not, we probably break even on the speech or make $5 or $10. Then why the heck are we having speech therapists if we're only making $5 or $10, right? Good question. The answer to that is this: if you have a referral, okay, if you have a referral, let's say that requires the three disciplines, PT, OT, and SLP, let's say a stroke patient, you need a speech therapist in order for you to land that referral. Because this is how a home health agency thinks, okay? For example, they have a CVA referral. They would call me, hey, Bert, we have a stroke patient, doctor ordered PT, OT, and SLP. Can you guys do it? All right. If I don't have a speech therapist and I tell them I only got PT and OT, they would tell me, we really want this referral to stay in one company. That way there's better communication. So this is why I have a speech therapist. Okay. I may not make money on the speech therapist, but I will make money on the PTA and the quota. Okay, or OTA visits. Now, I'm going to pause real quick because this is a hot topic when it comes to hiring PTAs and quotas. Some therapists don't want to use PTAs or don't want to use OTAs. Okay, that's their prerogative. Okay, some of our colleagues, and I respect their opinion, they think that, okay, I'd rather not use a PTA or OTA because I know better. I'm a DPT or a doctor of occupational therapy. I don't want to use any assistant. Okay. If that's your attitude, then you're not going to make money in this business. Okay. Let me tell you, I used to be like that. I used to be an arrogant PT thinking that only PTs can do a good job or a great job on a patient. But boy, was I wrong. Okay. Why was I wrong, or how did I prove I was wrong? Because results don't lie. Guys, results don't lie. You have to give the PTAs and OTAs a chance to prove themselves. Okay? The only way, I read a motivation today, motivation quote, the only way to prove your ability is by action. Okay? So the actions of your PTA, the actions of your OTA will prove if they can follow your plan of care, if they're making improvements on the patient's quality of life, and you as a supervisor, it's your job to make sure that they do follow your plan of care. All right. Do not discount PTAs and OTAs, just because, they're not, or they don't have the same degree as you as far as your level of, doctorate or master's or whatnot. Guys, results don't lie. I'm going to tell you right now, I would favor a PTA with 5 to 10 years experience than a new grad, even if the new grad has a DPT. Does that make sense? No offense. You may have a DPT, but if you're a new grad, I would trust my PTA with 5 to 10 years experience as opposed to trusting you handling a patient. Okay? Nothing against you, but experience is the best teacher. Okay? All right. Now, what if you have an SLP assistant? Okay. If you're a speech therapist, the question I get is, okay, can we use speech therapy assistants? The answer is no in geriatrics. You can only use speech therapy assistants in pediatrics. Okay. Plus, they have other rules if you ever do business with a pediatric home health. I don't do business with a pediatric home health. I just do geriatrics. Okay. All right. Guys, if you have any further questions, we're going to go on a quick break. If you have any questions, post it on the comments. And Mike, if you're there, Stacy, if you see any questions, I don't see them, let me know. And we're going to continue after this quick break. Hope you guys are learning a ton tonight. All right. We'll see you in a little bit.
HelloNote is a truly therapist-friendly practice management solution with integrated EMR that will enhance workflow, efficiency, and patient care. HelloNote reduces error and allows you to spend more time with your patients. It comes integrated with billing. Claims are generated once a note is completed. You can bill with one click and a patient portal, which streamlines the patient intake process. Beautifully engineered and cloud-based for easy accessibility, the software works on all platforms. You can access patient records from anywhere. We also offer 24/7 support. HelloNote is the practice management solution that you're looking for.
So much today from Dr. Mike Chua's Certified Dementia Practitioner live seminar. Not only was it about facts on how to help as a therapist treat those with dementia or memory deficits, but it was also about how to talk to family members, how to talk to caregivers, how to interact with the nursing staff in the hospital, and really how to present myself as a certified dementia practitioner. If you're looking to broaden your skill set with becoming a certified dementia practitioner, I highly recommend Dr. Mike Chua's seminar.
Hello, my name is Nina Chokashvili. I am support group facilitator leader and yes, a specialist and Alzheimer educator. So I just completed Dr. Mike Chua's 2-day class, which one was the best class. First.
The New Gate, restoring hope one step at a time. Are you struggling to keep up due to a walking disability? Be freed of your limitations today with New Gate. Unlike any other walking aid, our device is strategically customized based on your needs. The shoulder straps and waist belt will comfortably put you in proper position. Our assistance bands are placed according to your needs to drive gait forward. The assistance bands act like springs that produce energy when stretched. The energy created is used to assist with active contraction of the muscles. Dorsiflexion is assisted in order to ensure heel strike. The quadriceps and hip abductors are assisted to stabilize the pelvis. The knee, hip, and ankle joints are compressed, improving proprioception, stability, and balance. The calf and hamstrings are assisted to improve push-off and drive gait forward. The assistance bands are stretched and energy is stored. The assistance bands shorten to assist hip flexion and ankle dorsiflexion to swing the leg. Co-contraction of the hamstring and quadriceps is assisted to stabilize the knee and prevent circumduction and recurvatum. Your new gait is just a step away. Ask your therapist about the new gait or send us an email to learn more.
Okay, we are back. And guys, if you're just now joining us, we are live here at the Home Health Contract Show inside the Alternative Healthcare channel. All right, Home Health Contract Show. It is time to show you the money. All right. So if you guys are asking right now, how in the world is Bert making money? Show me the money, right? Okay. You're in for a treat tonight, guys. I'm going to show you a sample invoice, a recent invoice that we sent out, my company sent out, and then the check that paid that invoice. So I'm going to show you that. Okay. Show me the money. Here we go. So I'm going to share my screen. And then I guess I have to minimize this thing so you can see my screen. Can you guys see my screen? Can somebody say yes? Can somebody say yes if you can see my screen? Yep. All right. So here is the invoice. That's 1408, 14. Okay. Here's a sample invoice. This is my company, guys, Therapy Outsource here in Corpus Christi, Texas. This is invoice number 1407. Let me make it bigger if you can see it. Okay, let me make that bigger. All right, this is invoice 1407. This was in September. We're still in September, right? September 2nd, 2020. And then here are the visits that we did. I have to block it for HIPAA compliance, all right? But here you will see PT eval, PT discharge, PT re-eval, and then on the right side you will see the rates. There's $90, there's $125. This $125 is for a start of care. This is when you do an OASIS start of care or a resumption of care. So if you ask me, okay, Bert, where did this rate come from? These rates came from the contract that we signed, my company signed, Therapy Outsource, the company I own, that I signed with my client, which is the home health agency. So just to make sure, your client is the home health agency. Your client is not directly the patient. We are seeing the patients for the home health agency. That's why it's B2B, which means business to business. My business, my company, Therapy Outsource, is doing business with a home health agency. Okay. So the way it works, when a home health agency gets a referral from the hospital or the doctor, okay, they will call my company. Hey, Bert, we have a total hip patient. We have a total knee patient. We have a CVA patient, or we just got a patient from the hospital who just got out. Doctor ordered PT, doctor ordered OT. Can you see this patient? Okay. And then what we do is we look at our roster of therapists, PT, PTA, OT, OTA, and SLP. If we can cover the patient and we say yes, we will take the patient. And then after we see the patient, we create this invoice. What do you notice in this invoice? There are no billing codes. There's no ICD-10 codes. It's straight up $90 because that's our contract per visit, flat rate. Some contracts are $75 to $85, but this contract is a great contract. They pay well at $90. Okay. So I'm paying my PTAs $45. I'm paying my quotas $45. So for every $45 my PTAs make, my company also makes $45. Okay. Now, it doesn't matter how much money you make, as long as your PTA and quotas are happy with the rate that they agreed with you. You don't have to let them know how much you're making. That's none of their business. Their business is, if you promise to pay them $45, of course, you have a written agreement, then that's what you pay them. All right? Okay, so this is the first part of the invoice, 1407. The second part is the bottom part. This is the total of the invoice, $2,165. Okay, that's invoice 1407. Now let's look at invoice 1408 because these two invoices got paid at the same time. Invoice 1408, this was dated 907, and there you have it. You see the rates, you see the visits here, billed to the company that we contract with. That's my company. And then the second part of that invoice is this. $2,602.70. Okay. The reason we have this odd numbers is because we get paid during case conference. We charge $30 every hour for case conference. And what is case conference? Is when you call in every week. We call in on WebEx to discuss patients. Who's for discharge, who's for reeval, and that's not free. That's money on the table. Okay, you get paid $30. Now I pay my staff the same amount, $30. I don't make a profit off of that because it's a meeting. It's something that the company pays us, so I don't make money off of that. And this is why you see this odd number. Okay. All right. So the total of this is 2602. The total of the other one is 2165. Okay. That's more than $4,000 of invoices combined. Where is the check that paid these two invoices? I'm going to show you where that check is. Here is the check, guys. Kind of blurry because I tried to zoom in. So 4,767 is the total of those two invoices. It was paid on September 18th to Therapy Outsource, as you see in the bottom, 4,767 and $70. Now, let's look at the invoice number. There it is on the very top, 1407 and 1408. There's the 2165 and 2602. Guys, this is how my company makes money. This is how you do a side business as a home health contractor, business to business. Okay? Now, if you're someone who's doing PRN home health evals for a home health agency directly as an individual, okay, I bet you're not getting the leverage that a company gets. What do I mean by that? As an individual, if you're working directly for a home health agency, they only pay you for what you did, right? Eval, reval, discharge. But you're not getting paid for what the PTA did because this PTA does not work for you, or this quota and OTA, they don't work for you. This is why if you restructure that, which is what I teach, if you restructure that by starting your own home health contract company, you can now be in a position where you can have leverage and make a profit, make money off of the PTAs and the quotas. And like I said, at the same time, you're solving a problem. You're providing jobs for the PTAs and the quotas. They're happy. You're happy. Everybody's happy. Does that make sense? So this is how you do it. I hope you guys learn a ton from these screenshots that I just showed you. Okay? Now, if you guys have any questions, please feel free to put it in the comments. Do we have any questions? Okay, Rich Montes Claros has a question. Do you pay your staff via 1099? Okay, that's a very good question, Rich. Okay, so guys, if you're not familiar with what is a 1099, 1099 means you don't take taxes out. Okay, W-4 is when you get or you give your staff W-2. Okay, all right. So let's clarify this. 1099, you pay the full amount. For example, if you agreed to pay your staff $45 or $75 for the PT/OT supervisors, you are paying for the full amount, which means at the end of the year, your 1099 therapists are going to get a 1099 form instead of a W-2, which means they will pay their own taxes. Okay. The benefit of that is they can declare whatever deductions they have, either, mileage or equipments they use in working for you as a contractor. Okay. Now remember this. If you put someone on a 1099, they have to fill out an IRS form W-9. Okay. Remember the number 9. W-9, okay, W-9 is equals to 1099. W4 is equal to W2, meaning if you want to take taxes out at the end of the year, they will get a W2. Your staff need to fill out a W4. Now, one of the most common questions is this: can I have a staff that that's doing? Can I have a staff on W2 and another staff on 1099? You can, but I don't recommend it. Okay, and the reason for that is this: when you have a staff that's on 1099 and you have another staff on W2, that's going to be a problem, because if they're doing the same thing, all right, then it might be in question. How come this you're treating this staff as an employee and the other one you're treating as a contractor if they're doing the same thing? So the advice I got from my CPA is you have to make a decision. You have to decide whether to put everyone on 1099 or to put everyone on W2. It's got to be across the board. Okay, it's got to be the same. Okay, now you have to talk to your accountant. As a disclaimer, I'm not an accountant. Okay, I have an accountant, so you have to talk to your accountant or your accounting guy, whatever state you belong to. You have to talk to them and ask, hey, is it okay to put someone on 1099 in our state? Okay, if you're in California, the answer is no. California is very strict right now in classifying someone as an independent contractor because of the AB5 law. I don't know if it's in effect yet, to where you cannot be an independent contractor anymore. You have to take taxes out. And that's because the state of California, in my own opinion, they just want to get more taxes from people, because as far as I know, they're going bankrupt. The last time I heard. Okay, so now they're ramping up getting taxes and taxes. Okay, so Jorich, I hope I answered that question. Kelvin Esguerra has a question: how do you market to home health agencies? Very good question, Kelvin. Okay, a lot of therapists will tell me when they talk to me, hey Bert, I'm not a marketer, I'm a therapist. How am I going to market my company? Okay. My answer to that is you are a marketer. You just don't know it yet. You market yourself every day. If you're seeing patients 5 days a week, you are a marketer. Okay. What do I mean by that? What do you do when you first see a patient and you do your eval? Okay. You're marketing yourself. You establish rapport. You tell the patient who you are. You tell the patient what your plan of care is and what you can do for them. And boom, soon as you get the patient to agree with you, then guess what? You do your plan of care. That right there is marketing. That's the essence of marketing. You tell them who you are. You establish rapport. What can you do? And then deliver. Same thing with home health agencies. You tell them what company you have, what does your company cover, what disciplines you have, and what can you do for them. It's as simple as that. Okay? Don't be scared by the word marketing. Guys, marketing is as simple as having the confidence to approach someone and tell them what you can do. And you're doing that already. As a therapist, whether you're PT, PTA, OT, OTA, or SLP, you're doing that with your patients. It's the same dynamics. All right? Okay, good questions. Keep the questions coming, guys. Another question is, could this work with a home care agency? This is exactly for a home care agency. That's why it's a home health contract show, okay? What I mean by that is we are contracting with a home care agency. Okay, we are not a home health agency ourselves. Like my company, Therapy Outsource, is not a Medicare certified home health agency. We work with a home health agency that's certified by Medicare or has contracts with insurance. We provide the services. So in other words, it's no different from a travel staffing company. We staff PT, PTA, OT, OTA, and SLP. However, on a local level, meaning, you staff the agencies in your area. The difference is this: a travel agency will staff hospitals, SNF, or other facilities from anywhere in the US on a 13-week contract, meaning whether they have work or not, for 13 weeks, they have to get paid. This is why they signed a contract. This is why they can afford, providing housing and allowance to traveling PTs, traveling OTs, PTAs, and OTAs, and even SLPs, and even the nurses. That's how it works. They charge a ton of money so they can afford what they offer you. Now, the advantage of us as a local home health contract company, we don't require a 13-week contract. Okay, it's a pay as you go. In other words, you tell the agency, look, you're not going to pay me 13 weeks with or without patient. You only pay me, my company, whenever you send us a referral and whenever we see that patient. It's a pay as you go. They prefer that as opposed to hiring a traveling therapist from a travel staffing company, because now they are not committed to paying 13 weeks worth of work with or without work. Does that make sense? This is why we provide a better solution than a travel staffing company. And since you're local, okay, since I'm local, right? Therefore, I know more therapists in the area than a travel staffing company based in New York or Florida or California. I'm in Texas, so I know therapists in my area. So I can use that as a marketing tool. Look, we can help you. I can help you. My company can help you because I know therapists in my area. All right? Hope I answered that question. Okay, home care, Medicaid. Another question. Okay, since we're a home health contract company, it doesn't matter whether the home health agency has contract with Medicaid, Medicare, Blue Cross Blue Shield, Aetna, United Healthcare, Humana. Those are the contracts of the home health agency, not you, not me. Okay, we don't have contracts with these companies. The home health agency does. What we do is we provide the work and then they pay us for the work. All right. Okay, any more questions, guys? Keep it coming. All right. Mike, are we going to another break before we close? Let me know. All right. So what other common questions do I get from, therapists that want to do a home health contract business? Okay. Most common question is this. Okay, Bert, how do I know I have a chance to have my own home health contract company if there are already other contractors in the area? Okay. They're afraid of starting their own company. They're afraid of, doing this because they think there are already other therapists in the area. The market is saturated and stuff like that. Let me ask you this. Why did you go to PT school, PTA school, OT school, and OTA school, and SLP school? Why did you go to that school if you already know there are other PTs out there? If you already know there's other PTAs and OTs and OTAs and SLPs out there, right? Why didn't you say to yourself, I'm not going to go to PT school because there are already those PTs who graduated before me? Why? Because there's a market for everyone, right? How many pizza places do you see in your area? Do you just see one? How many burger places do you see in your area? You only see one? Well, unless you live in a town with 300 people population, then yeah, probably just one. Okay. Now I'll be straightforward with you. If you're in a city where you only have one home health company, you're probably not going to make it in this business. Now in our program, I teach you how to look for how many home health agencies are in your area. That's part of the program. Okay. So if you're in a major city or you're in a place where there's at least 5, even 3 to 5 home health agencies that serve your area, and there's not a whole lot of a home health in the area, that's more than enough for your business to thrive. Okay. Now, how do you know if your business is going to thrive? Okay. It's really up to you. If you want it bad enough, you're going to make it happen. If you don't, if you don't want it bad enough, guess what? You're going to come up with an excuse. Again, I'm going to go back to the quote I said when we started. The only proof of your ability is action. If you don't take action, then that's it. It's just a dream. Okay. So this is why I started the home health contract business back in '03. I was tired of working for someone. I was tired of, going home and doing the same thing again and again. I just want something different. So I took action. I started my own business. 2003 is when I started it, mid 2003. It's now 2020. It's now 17 years, and I'm still doing it. And besides doing it myself, being out in the trenches, I'm also coaching, I'm also mentoring colleagues, how to do this business. All right. So we are getting close to closing our show. It's almost 9:30, but I am gonna answer one more question. Okay, this is a great question from EWA. I don't know if that's your name or that's just your YouTube username. But anyway, his question or her question is, how do you recruit therapists and assistants? Okay, very good question. Bert, how am I going to recruit therapists and assistants, supervisors and assistants? Okay, let me answer that real quick. How do you talk to someone if you go in a party or if you're in a bar or something or any gathering? How do you talk to someone? You just talk, right? You just establish rapport and talk. Okay, so this is how I do it. Let's do a role play. Let's say I got someone that I met or someone told me they're a PTA or a PT. I would call them, or if it wasn't for COVID, we would meet face to face and tell them again about my company. Same dynamics as talking to a patient. Hey, I heard you're a PT. Are you looking for any PRN work? I have my company. We do home health contract, and sometimes I need help with evals, re-evals, and these charges. If you're looking for some extra work, you want some extra money for your beer money or shopping money for you or for your wife or just extra money to pay your student loans, hit me up. Here's my number. Here's my card. Okay. That's it. It's as simple as that. You just talk. Okay. Don't be afraid to ask a colleague. My goodness, they're colleagues. You got to talk to them. All right. And they won't know about your company unless you talk to them. Okay. Again, it's like talking to a patient. You establish rapport and tell them what you want. Okay. Now, don't be afraid for therapists who would tell you, no, I'm okay. I'm fine. I don't want to do that. And move on. Okay. There's other therapists in the area. Okay. Especially now that there's a lot of therapists that got laid off, got furloughed. Okay. If you're a PT, PTA, and you got laid off, you got furloughed, I bet you're looking for some means to make ends meet, right? And this is a great solution. Now, not everybody is wired to do business, and that's okay. Because if everyone is going to do business, then no one will become our staff. No one will become our employees, right? And that's okay. But if in your heart of hearts, you're tired of working for someone, you're tired of productivity, you're tired of the politics in your workplace, and you can give this a shot, okay? And that with some guidance from a person like me who's been doing this for 17 years, I will guide you from the beginning to the end how to do this with some guidance. You can make this happen. Reach out to me, okay? Message me inside Alternative Healthcare Group, or as a matter of fact, you can text me directly. Mike, if you can put in the comments my phone number. I'm probably one of the few coaches that will give you my phone number. You can even write it down now. It's 972-649-9909. Again, that's 972-649-9909. I'm very informal, guys. Just text me, hey, Bert, I saw your home health contract show. I have a quick question. I'll talk to you. Okay. If I don't answer directly or if I don't answer right away, I will definitely get back to you. Okay. Facebook Messenger or not, or text me at 972-649-9909. All right. I think that will wrap up our show for tonight, guys. Again, Home Health Contract Show is every Monday, 8:30 Central here inside the Alternative Healthcare Career Channel. Every Monday, 8:30. Put it in your phones as an alarm. Put it on Monday. If you use an iPhone, Android, there should be some system in there to put the alarm every Monday, 8:30. Get your questions ready. Reach out to me if you want to be a part of my mentorship program. I will teach you how to do this from the beginning to the end, from step one to step done. All right. Thanks for joining us tonight, Home Health Contract Show. We'll see you again. This is Bert Devera, physical therapist, signing out. Good night.